Good afternoon, everyone.
Good afternoon.
All right. I'd like to say hello to the honorable members of the Maryland Legislature, the health partners, youth ambassadors, the opinion leaders, and everyone else in attendance today. And I'd like to take a moment to say thank you to the illustrious ladies of the Links Incorporated, particularly their president, as well as the members of the Links at the Legislature Committee for your warm invitation and bringing me here to speak to you this afternoon. Your initiative here that you've been conducting for the last 8 years is very admirable. It's so very much important that we do everything we can to promote the mental, financial, and physical health and well-being of our kids, because of course they are our investment in the future, and without them, what will we do? Where will we move forward? So I'm looking forward to sharing with you my personal story in healthcare. Guns can end lives, but they cannot kill spirits. Now I find that a single bullet could not silence a voice. I'm here today to give voice to the voiceless. I am the voice of Amber Stanley, Markel Ross, Eliza Reyes, Marcus Jones, Charles Walker, Aaron Kidd. If you did not recognize those names, those are 6 Prince George's County youth who were murdered in the last 6 months. I'm also here to give voice to Carrie Hughley III, my brother, who died at the age of 21. Injury is the #1 killer of Americans 44 years of age and younger. 1 in 3 girls will fall victim to domestic violence, while 1 in 4 boys will also fall victim to domestic violence in any given year. Males of all ages are 14 times more likely to suffer and die from a traumatic brain injury. But I want to focus our attention on intentional injury and especially violence. And I really appreciate the opportunity that the Links have given me to speak in this forum today, because I usually don't get to tell the entire story of my brother, his life, and his death. Indeed, according to the Youth Risk Behavioral Risk Surveillance System, there are so many Maryland youth who are at greater risk than other youth in the United States for many injuries. And this is because of their behavior. So that includes, with regard to domestic violence, for example, Maryland youth have a 2 times greater than the national average prevalence in falling victim to domestic violence. There's also an elevated prevalence rate among Maryland youth in terms of carrying a gun at least once, being injured in a fight at least once, attempting suicide more than once, and being injured from that suicide attempt. So your legislative agenda, particularly HB 453, can really help address these issues. Guns are simply too easy to obtain illegally. Universal background checks and strict enforcement against gun traffickers are 2 things that it's really going to take to address the problem of violence that we have today. We live in very paradoxical times because the overall crime rate is down, but we still have these incidents of violence. 6 youth in 6 months murdered. And there's not enough being said about that. So, consider what one Washington Post columnist said. Our children are scared. Bullets can find them anytime, anywhere, even if they play by the rules. And this is exactly what happened to my brother. He was a little bit older. He was 21, living in Richmond, Virginia. He was going to school. He was working at the Science Museum, living not too far from the campus of Virginia Commonwealth University, when an acquaintance purchased a gun illegally, a .22, concealed that weapon, gained entry into their house because they did know him, but not very well. He distracted my brother, put that .22 to the back of my brother's head, and shot him dead. He proceeded to my brother's roommate, asked the roommate, "Are you ready to walk with Jesus?" Pulled the trigger, and fortunately, the gun jammed. My godbrother, my brother's roommate, was able to wrestle him out of the apartment. This man, who was later diagnosed with paranoid schizophrenia, had the wherewithal to illegally purchase a gun, conceal that gun, and then flee from Richmond all the way to Florida before he was apprehended by the cops. That is the personal face of violence. And this is what greeted my family when we entered the hospital. I'm reading to you an excerpt from 3 Gifts. It's a collection of poems and photographs that my late brother wrote, and I compiled and published. And there's a postcard of how to get this book in your gift bags. So this is from the afterword. Just before dawn, we reached the hospital where my brother had been admitted. He was in an ICU hooked up to a ventilator with only a minister and a hospice nurse by his side. It was so hard to see his muscular body lie there, nearly still, save the work of the breathing machine. I could not understand why they had not operated. Immediately, I began making demands and requesting the admitting physician from the ER. Instead, they brought me the chief resident. From him, I requested to read the admitting doctor's notes. I needed to know everything that had happened until the moment we arrived. Ultimately, as they realized I was someone with knowledge of teaching hospitals and its hierarchy, the attending physician on duty came with the films to explain the grave prognosis. And there it was plainly, my once vibrant, healthy, athletic brother lay dying with a bullet lodged in his brain. It was put there, the Virginia courts would later rule, by someone incapable of understanding the consequences of his actions. That was not the end of the story. We were approached by someone from an organ procurement organization to ask us about organ donation. This was not a new conversation for me, because at the age of 16, my brother, in his excitement for sharing his driver's license, pointed out to me that he was an organ donor. It was a very quick, a very simple conversation that, quite honestly, never went any further. I never shared it with my parents. But as soon as we were approached, I knew it was the right thing to do. I knew it was what my brother had wanted. And this is why, if someone in your family or for yourself, if you haven't made that decision to become an organ donor, you should be willing to make that decision. In the face of our own tragedy, we could not ignore the needs of others. 117,271 Americans await at least one organ today. 2,416 of those live right here in the state of Maryland. Indeed, every 10 minutes that list grows when a new name is added to the list. And every day, 18 people run out of time and die before a matching organ is found for them. Now, in this beautiful audience of people of color, it's important to understand that more than 54% of the people on that list look like you and me. And while donations across cultures and ethnicities happen all the time, there is a greater biological match when it comes from someone of the same ethnicity. So yes, I'm here to advocate for policies that improve our behaviors and protect our youth. Expect the best. but in face of horrible, horrible tragedy, plan for the worst. We talked about this. In effect, my brother was doing end-of-life planning at the age of 16. How insightful is that? How generous is that? Indeed, donating organs is the ultimate act of charity. All religions support it. My family paid nothing for my brother to be an organ donor. You can best believe from the description I read to you, everyone in the hospital busted their tails trying to do what they could for my brother. But it was the type of injury that is fatal. Eventually, when that attending came, he brought the x-ray to me and showed it to me like I was a part of the clinical team, because I advocated and demanded that type of health care for my family. But once we understand the situation, we were willing to play our part in the cycle. I do want to speak a little bit towards mental illness and mental health because it is so important. I spent many years very angry with the mother of the person that murdered my brother. And it's for this reason. If your child or your daughter passes out in a diabetic coma, would you leave them there? If your child had an epileptic seizure, would you leave them there? If your child is displaying signs of mental illness, ignoring it is not going to make it better. Okay? Early intervention is the key, but we can't treat something that we don't address or don't acknowledge exists. Now, I personally, though this person was ruled unable to stand trial and was remanded to a state hospital, it's important to understand that most mentally ill people are more likely to be the victims of violent crime than the perpetrators of that violent crime. So as we move forward in our gun regulation, do not be lulled into a false sense of security by thinking, oh, everyone with a DSM-4 diagnosis is on our list and being checked and not being able to get a gun legally. Most guns are obtained illegally, and more important than that, most people at risk for using a gun are clearly not mentally ill, just angry. This is a very complex problem that we have to take a holistic approach to address. So, just in closing, I want to encourage everyone, let's do all that we can to help our youth shine their light. And then, when the time comes, be willing to help them pass that light on. Thank you very much. Register.